And so today I will be covering a little introduction of UNFPA, as well as touching on the USAID UNFPA Reproductive Health Products Global Traceability Advisory Group that Rami just touched on earlier, and our initial requirement for harmonizing on barcodes for contraceptive products. So, contrary to the acronym that you see up here, UNFPA actually stands for the United Nations Population Fund. And we're the principal global intergovernmental organization in the UN system with the mandate specifically for family planning. And we are leading the global efforts for providing access to family planning information, services, and supplies to individuals as well as couples who want to have the choice to choose when and how many children they want to have. So UNFPA has offices in 136 countries. Like I mentioned, apart from the capacity building activities that both USAID and UNFPA provides to countries, we also procure a number of supplies. And this is centralized and managed under the Procurement Services branch located in Copenhagen and Denmark. So if we are talking specifically reproductive health products, UNFPA in Copenhagen has procured over $178 million of products and delivered to 113 countries. And the product mix based on the method is shown here in the pie graph on the right. And so USAID and UNFPA combined, especially in the space for family planning, we make up about 70 to 80% of the total donated commodities that is supported to the countries that we both operate in. So having said that, USAID and UNFPA has decided to combine and do a joint collaboration on, especially on the reproductive health space for traceability. And we want to formalize an advisory group to really push this initiative forward. And so why do we need an advisory group? Well, if we're just even talking about harmonizing the barcodes itself or any equivalent AIDC that we want to put on the product, we really need some sort of umbrella organization or committee that is going to push this from not a project, but more of a long-term program, so a longer-term commitment to look at this, because as you've seen, this is a long journey ahead, and we're at the very beginning stage of this. And also, as you've seen from all the other presentations from the participants here throughout the conference, really to make this work, you need to adopt, or to make the track and trace systems work, we need to adopt open standards and also have pan-industry cooperation. So it's not just talking with the manufacturers, but you also need to talk with the logistics and transport provider as well, right? And so with the advisory group, we're hoping to formalize a dedicated forum where we can have that dialogue on a continuous basis, but also have that feedback loop from the industry and other subject matter experts regarding the direction that we want to take, whether it be on the barcode itself, but also the data exchange as well. So yeah, the mission really for this advisory group is to provide that forum, right, for the industry and other subject matter expert to engage in a constructive dialogue, to come up with recommendations of how we can implement, not just on a small scale, but large scale, of open standards for reproductive health commodity, really on the identification, data capture, and data exchange, right? So the interoperability of systems that Rami also just mentioned. And so some of the early requirements that we're looking at for, at least on the barcoding side, so for the barcode symbology, I'll touch on the tertiary and secondary package level. So these are the pictures of the barcodes that were used for the Ethiopia pilot. So we're looking at GS1 128 and the 2D data matrix. And I think it's maybe fairly simple for a lot of industry players that have experience in this, but some of the conversation that we had with some discussion with the manufacturers that we procure from when we say 2D barcodes, they would often give an answer saying, yes, we can definitely do that. And when we do the validation of the two-dimensional barcode that is provided, even though we said we want a data matrix, a lot of the time it's a QR code that comes back at us. And so that's kind of the level we're at right now. And so there's a lot more education that has to happen on both sides. Another thing is, and this picture, it's great that it shows in the secondary package level, we managed to have the data matrix and also the human readable interpretation, but maybe some of you who joined, I think it's Grant from GSK, the presentation about the application identifier. Clearly we overlooked this when we tested it in Ethiopia. But again, this is another thing that if we had an advisory group, we could get that feedback from the industry or subject matter expert before we start distributing it within the country. Also, another thing that someone touched on earlier today, this morning, was the quality of the barcode. So Al mentioned that the two-dimensional data matrix is hard to scan and capture the data, but it's also the quality of the barcode that was printed wasn't, I would argue, sufficient enough. And that's not just the actual images, or I mean the quality of the two-dimensional barcode that's printed, but the position of the barcode as well. And so for us, I know there's been discussion about serialization and also tracking or tracing at the primary unit level for patient safety, but I think for us, we're going to be targeting, at least in the beginning, is the secondary tertiary package, including the palette. And this is really because I think there's been quite a bit of experience from the industry side that has done a lot of great work, and we want to leverage this, but also we don't even have that track and trace in real time or near real time at these levels. So we want to start off with these first and then move on to some of the more challenging areas. And so another thing is in the picture that you saw in Al's slide, I don't know if you noticed it, but the colleague who was doing the scanning with the mobile devices, it was quite difficult because while we imagine when we received the product at the central warehouse and the products on the pallets, and they had the label that's compliant to GS1 standards on the tertiary package, but the issue was there's a plastic strap over the label. So what happened was someone else had to push it aside, so it wasn't a straightforward thing. It was quite embarrassing when we're talking to the warehouse managers about how easy it could be to scan and capture the data. So that was something that I know that GS1 has a guideline or a recommendation on label placement, as well as the number of labels that they would recommend on a tertiary package. But again, it's something that we didn't have that much experience when we were testing it for the pilot, which we hope to improve by formalizing this advisory group again. So the next steps for us really is to finalize the terms of reference that we have drafted already for the advisory group and confirm interest and participation for the advisory group by also clarifying, really defining what the objectives are and the users and expected benefits from formalizing this advisory group. And one thing I also forgot to point out is the whole background, again, with the track and trace is not only looking to get supply chain data visibility of the products that we are donating to countries, as well as saving lives, but there's also this issue that we know, but we don't know how bad, I would say, the integrity issues, right? So the supply chain integrity issues. Unfortunately, we're not immune to that either. So there's falsified products that we know somehow makes it into the public health supply chain, and as well as theft and diversions that somehow it gets leaked into the for-profit market. So the beneficiary who requires these products ends up not getting it. So that's also another aspect that we really want to address more seriously, and we're hoping that this track and trace initiative and also that advisory group, we can move towards that direction. So thank you.